The number of confirmed cases of the deadly coronavirus in Australia has risen. This is the latest on the situation. Health authorities in Queensland have confirmed the state's first case. A 44-year-old Chinese national is in isolation at the Gold Coast University Hospital. A second case of coronavirus has also been confirmed in Victoria, so 2 in that state. The total 7, with the other 4 cases from New South Wales. Chinese authorities have revealed the virus has infected nearly 6,000 people. The death toll, 132. Australian residents trapped in the coronavirus epicentre are weighing up an evacuation offer from the federal government. The coalition is offering to quarantine them on Christmas Island for 2 weeks, but the transfers are yet to be approved by Beijing. Live to political reporter Eliza Edwards for more. Eliza, it could be at least a few more days before anyone is moved from the Hubei province.
And that's if they even decide to be evacuated. And that's right, the transfers are also yet to be approved by Beijing. The government hopeful it'll hear back today about the repatriation of up to 600 Australian residents in Wuhan. There's also been a lot of criticism of the decision to use Christmas Island as a quarantine facility. Our cameras were given access to the island last March, and these pictures show what the government believes is a purpose-built centre. The Home Affairs Minister saying it's not feasible to take over a hospital on the mainland.
Just don't have an empty hospital sitting around. I can't move people out of Royal Brisbane Hospital or a section of that. We have a facility purpose-made for this type of event on Christmas Island. We want to make sure that Australians are safe, that there's not a spread of the disease, of the virus, and we've worked very closely with the Chief Medical Officer, and we've looked at different facilities, and this, in our judgment, is the best.
Now, despite these assurances, an Australian trapped in Wuhan is worried about the medical facilities on the island. He's also put off by the fact that it's a detention centre. Daniel Oyan says he and his family are still weighing up the government's offer.
My family and I are discussing the pros and cons about it. I think that the main concern that I have, and I feel as the whole of us over here would have, is the lack of transparency with the process in the Christmas Island and what we're allowed and not allowed to do, and our living conditions over there. You know, it being a detention centre is obviously a put-off, and I'm just not quite sure how effectively or how professionally we can be quarantined, not in a medical facility, but in a detention centre. The cost is not the problem. Like, if I have to pay the money to get on a flight or whatever, fair enough, all right, I'll do that. But it's mainly concerned for, will I be able to access the internet? Will my family be able to contact me? Will other people be able to contact me? And can I bring my phone there? Are they going to take my phone away from me?
After previously treating Australia's coronavirus response in a bipartisan fashion, Labor is now criticising the Christmas Island plan, calling into question whether it's being used to justify the $185 million cost of reopening the centre when it's barely been used.
It's unclear whether that is motivated by a genuine belief that that's the only they need to be seen to be doing something at Christmas Island other than holding a press conference to Scott Morrison.
Tom, the government's also been trying to sort out some operational hurdles to getting people out of Wuhan. Qantas saying it can't land a Boeing 737 on Christmas Island, so if this plan does go ahead, a smaller plane will need to be used.
Eliza Edwards, thank you. A 44-year-old Chinese national has been confirmed as Queensland's first case of coronavirus. Let's go live to Julia Bradley on the Gold Coast. Julia, what do we know about this first case?
Well, Queensland health authorities say this 44-year-old man is in a stable condition at Gold Coast University Hospital and in isolation. The man is from Wuhan, which is the epicentre of this coronavirus. Queensland Health, they will be providing a further update later this morning on the travel movements of this man prior to his isolation. And the news of Queensland's first coronavirus case, it does come as the Chinese women's soccer team are put into isolation at a Brisbane hotel. They travelled here from Shanghai yesterday morning as part of the Women's Olympic Football Tournament qualifiers. And it's understood that they were in Wuhan 1 week ago. They haven't presented any symptoms for the virus as yet, and they were thoroughly screened by border officials upon arrival. But now Queensland Health will be working very closely with this Brisbane hotel to ensure that these team members and hotel guests are kept separate.
Indeed, Julia, that's part of the scramble. In Melbourne, there's a desperate search underway for people who dined at a restaurant in Glen Waverley on Sunday. A man ate there before his case of coronavirus was detected. Let's go live to Patrick Murrell. Pat, the restaurant has been closed as a precaution.
Yeah, that's right, Tom. Although the official advice from health authorities is that the risk of transmission here is low, the owners are taking every precaution they can, and they're certainly taking no chances. They closed up shop until the 9th of February. This is after the second confirmed case of coronavirus in Victoria. A man aged in his 60s recently returned from Wuhan in China 2 days after getting back to Australia. He was diagnosed with coronavirus, but during that time before he tested positive, he ate here at the House of Delights Chinese restaurant in East Melbourne, Glen Waverley. He ate between the time of 5:30 p.m. and 7 p.m. on Sunday. So health authorities are scrambling to contact everyone who might have been there during those hours because they may have been exposed to the virus. The risk of transmission is low, but they want to monitor them for any symptoms just in case. Now, this man, he's aged in his 60s. He was treated for coronavirus at the Monash Medical Centre. He's since been released and is in isolation at home for 14 days, and he'll remain there for 14 days while he recovers. Health authorities are also monitoring those he's had close contact with, including 2 young children, for any symptoms.
Patrick Murrell, thank you.